Good day. With this presentation, I'm going to give you feedback on formative test 2. Please ensure that you first work through the test yourself so that you can self-mark as you view the feedback. This formative test has two sections. In section A, you have multiple choice questions, and then in section B, there are scenario type questions. So for section A, then the first question there is a Galeazzi fracture is a fracture of, and the answer there is, of course, a radius with associated dislocation of the distal radial ulnar joint. The other option, ulnar with associated dislocation of the radial head, is, of course, a Monteggia fracture. And the next case has an image to it. Identify the arrow structure from the drop-down menu, and that is a heel sacs deformity, which we see in the superior lateral corner of the humeral head, and it's associated with recurring anterior dislocation. The Bankart lesion is a lesion that you will see on the inferior glenoid rim as an avulsion type fracture. The light bulb sign is associated with posterior dislocation, and then an aneurysmal bone cyst. You would see an area of lucency within the bone. So the next question, the first ossification center to appear in the pediatric elbow is, of course, the capitellum. And here I want to remind you about the mnemonic Krytol, which shows more or less the appearance of the ossification centers. So the second one to normally ossify would be the radial head, and then the medial epicondyle of intermediate epicondyle is the third one, and then the lateral condyle is the final one to ossify. So with this question, there are multiple answers here, so there's more than one. And this question is related to osteoarthritis. So the question is which options do apply to osteoarthritis? And for that, it is joint space narrowing, osteophytosis, and sclerosis at joint margin. So there's three of the options that do apply for osteoarthritis. So the next one is related to avascular necrosis, and the one that's listed here is Kienbock's disease, and Kienbock's disease is AVN of the lunate. Remember to review the other areas as well, so of areas where you will find avascular necrosis. So in the navicular bone, that is called Kohler's disease, and then in the foot, the metatarsal heads, that's Freiberg. Of course, the one that's quite common is in the femoral head, which is Perthes, and then Scheuermann's disease, which is ring apophyses of the spine. And then the last one to think about is Osgood-Schlatter's disease, which is AVN of the tibial tubercle. And then question 6 is again a multiple answer MCQ. So which of these appearances are in keeping with malignant bone tumors? And that, of course, is poorly defined margins, interrupted periosteal reactions, and soft tissue mass. So there's again 3 answers there, each equaling 1 mark. So going on to the scenario-based questions. So for the scenario-based questions, each of those are equal to 3 marks. So you need to write at least 3 facts, even if the case is normal. So if it's a normal case, you could refer to the fact that there's no bone fractures, that there is no malalignment around joints or any signs of soft tissue abnormality. And for these cases, there will, of course, be within the formative test, the image manipulation software, and the URL is included in the test as well. So case one is that of a patient who fell onto the right elbow. So if we look at this case then, so on the lateral view, we can see that the posterior and anterior fat bands are elevated. However, if we draw the anterior humeral line, the radiocapitellar line, so there's no malalignment, so there's no evidence of any dislocations. We can't see a fracture either. However, because of these signs, there is a high suspicion then of an occult fracture. So the next case is a right shoulder of a patient who fell with a query fracture dislocation. So especially if we look now at the Y view, we can see that the humeral head is displaced laterally. And that indicates posterior dislocation of the glenohumeral joint. But also important is that there is a fracture of the clavicle as well. And this fracture is overlapping. It's an overlapping fragment, so it means there's foreshortening of the clavicle. The third scenario is that of a forearm with a patient who had a foot injury and now has a dinner fork appearance. So it's quite evident that we have got fractures of both the radius as well as the ulnar. But on the lateral view, we can also see that there's some angulation at the fracture points for both of the radius and the ulnar. However, when we look at the joints, doesn't look like there is any dislocation at the distal radial ulnar joint. And there's also some soft tissue swelling around that area. You can further describe the fractures as transverse fractures to both of the diaphyses, and also that it's the distal third that's been affected. So for case 4, we have a patient who fell off a trampoline, has restricted range of movement. So we can see that this is a pediatric case because of the unfused apophyses that we're noting. So these are not fractures, they're just unfused apophyses. If we look at the shoulder joint as well as the elbow joint, the radiocapitellar line, and here we can measure that. So the radiocapitellar line shows that there's no dislocation. More difficult to talk about the anterior humeral line because the elbow, of course, is not in an ideal position. It's not been done for the elbow. However, there's no evidence of any fractures or dislocations. There's not even any signs of soft tissue, abnormal soft tissue. So this is a normal case study. And then the final case is a patient with an elbow injury with lots of swelling and decreased range of movement. So on the lateral view, we can clearly see that there's an intra-articular fracture through the olecranon process. And there is retraction of this fragment of about, if you would measure it, around about 2 centimeters approximately. And also that there is a small bony fragment within the soft tissue between the fracture and the ulnar as well. And you'll be able to see that much better on the image manipulation software. We also have got elevated fat pads and significant swelling around the elbow. Okay, so that is all of the cases then that I've gone through. You can undertake this as often as you like. Remember, as you prepare for your final exam, which will include all of the teaching that we've done, so you need to look also at formative test 1 as well when you prepare, see the type of questions that can be asked. So if you've got any questions around this formative test 2, please feel free to contact me. Thank you.